Good morning. It's Monday morning movement and happy Memorial Day. Today we have a special guest on Monday Morning Movement. It is Dr. Cindy Works, and what she is a family practitioner who actually focuses on geriatrics. And I kind of challenged a few of you yesterday and asked you, do you pee your pants? Because at one time I actually did, following the birth of my children, just because even though I had C-sections, it was a problem. And I think a lot of women have this issue, particularly if you continue to be very fit and jump and move, but men and women often just cough and sneeze and pee their pants. So we're going to ask Cindy a few very specific questions like, how does our pelvic floor change as we age? So Cindy, give us the lowdown.
So I think, many of us are childbearers, and that's really hard on the pelvic floor to start with, is having a baby. And C-sections and hysterectomies, and there's lots of things that go on with a female anatomy that can change how the pelvic floor works. I am no expert in how the pelvic floor works. Sharon, my friend, probably knows more, as do many physical therapists focus on women's health and strengthening the pelvic floor. So I trained as a family practice doctor, and we get our basic anatomy, but we're not really trained so much in all the changes that go with the pelvic floor. What I know in general is that the pelvic floor is very dependent on the female hormones. And as we lose particularly our estrogen, there's some changes that happen in the pelvic floor and also in the vaginal vault. So things get drier and it just becomes weaker down there, as well as muscle tone all around supporting the pelvic floor, whether it be in your hamstrings, your quads, all of those, as well as the increasing intra-abdominal pressure some of us get as our bellies get a little bit punchier as we age. So those are just some of the things that can happen as we age. It is a really common problem I hear from elder women is the issue of urinary incontinence, whether it be stress incontinence, which has to do with the coughing, sneezing, jumping. And then there's also urge incontinence, where you feel the urge to go to the bathroom and you can't get there fast enough. So I do think there are lots of things that particularly physical therapists can do to kind of help women become aware of their pelvic floor, how it works. What I can say is the medications we have to give sometimes are less than optimal due to the side effect profile that they have, especially in elders. And surgeries have also not gone well for many women who get bladder suspensions, mesh put in. They last for a period of time, but then as everything gets weaker around it, it still isn't strong enough. So what I would say is that movement and having pelvic floor awareness and knowing how to use those muscles are really important. And also a big way the pelvic floor can change is if you have a hysterectomy. You lose the weight of the uterus when it comes out, but it changes the whole dynamic of how the pelvic floor works. And there are also many physical therapists, and like for my own sister, I definitely recommended that she go see a physical therapist after she had a hysterectomy. So that's what I know.
Cool. Now what I know through research, though, is the pelvic floor system is an entire muscle system. And if it's a muscle system, and how we train in pre and postnatal Pilates is that we want a pelvic floor system that's actually long and strong and actually short and strong. Because the pelvic floor system actually is the pelvic floor, the bowl is actually for protection. It's for accommodation of a fetus, but it's also for anchorage. And if you actually do pee your pants, or dribble, or you think you have the urgency, we would suggest, of course, to go see a doctor. Sandy and I suggest going to see a pelvic health PT, because pelvic health PTs, what do? Yes, they have access to internal and external kinds of treatments, but more than not, they move. And this is one of the reasons they move you, the client. This is more why you're beginning to starting to see PTs actually go into the area of Pilates elongation. So they're trying to build that muscle system in itself. But the big question is this: what can we do as we age to actually support the muscular system of the pelvis, we're going to show you 3 things. And actually, all 3 things I do rather religiously. Yep, almost every day. I've already squatted, that's one. But we're going to talk to you first and foremost about breath, because the breath that we promote in Pilates is called lateral thoracic breathing. And so we want you to recognize that this breath has a connection to the diaphragm, but the diaphragm and the pelvic floor actually connect neurologically. So when you expand your diaphragm out 360 degrees like an umbrella, your pelvic floor actually lowers. The reason is because there's a part of the diaphragm that actually pushes against that abdominal sac here that holds all of the contents, and that in itself pushes down against the pelvic floor system. And when you exhale and you pull everything up and in, like we often talk about, your pelvic floor often contracts. Now, what if you don't even feel that? We're going to show you one thing you can do as actually locate the pelvic floor. In other words, 20 years ago, Cindy, my doctor used to say, start and stop your urine.
Yep.
But now what the research says is, yes, that's an okay thing to do because it's a good locator, but they don't want you to continually do this. And this is what the research says. It says that that kind of patterning of the pelvic floor, that kind of movement of the pelvic floor by stopping and starting your urine so many times, actually sometimes increases your inability to empty your bladder completely. And what does that cause? If you can't empty your bladder completely, it causes urinary tract infections, and UTIs is something you don't want to have. And so that's an important reason why you need to be careful about stopping and starting your urine. But keep in mind that it's used as a locator because it helps you find your pelvic floor. We're going to show you 3 things today, and the first is in a chair, and Cindy's going to be my guinea pig. So let me make movement really quick. So I have Cindy right up against a chair, and the reason I have her up against a chair is because, as always, I want her to recognize her neutral spine. Because guess what? The pelvic floor, the pelvic bowl, is actually the foundation of your spine. So all I'm going to ask is I'm going to place my hand behind Cindy where her bra line is, because I want her to take a deep inhale and expand that rib cage. Now, I already can see the stress in your shoulders, Dr. Works. Because it's the exhale that I'm hoping, and she's sitting on a pine chair, it's the exhale when she exhales and comes up, and I know that in Pilates, I've taught her this lateral thoracic breathing, and she uses it in yoga, which is cool. When she's pulling up and in on the exhale, I want to see if she can feel the rise, okay? So think about expansion of your rib cage. Take a deep inhale. There it is. Exhale. Everything pulls up and in. So that's the imagery we create. Let's do that 3 more times. Exhale, pelvic floor lifts. There we go. So inhale, pelvic floor, diaphragm expands. Exhale, pelvic floor lifts. And one more time, Cindy. Inhale, this is when the pelvic floor lowers. Exhale, this is when the pelvic floor lifts. Did you feel anything?
I think so. Yes.
Do you feel the pelvic floor lift?
Yes, I can feel that.
This is a great opportunity for you. And think about all the times that we sit. Yeah, we sit way too much, but when we sit, we can take advantage of this in a very hard surface. Often we sit women up against the wall to where their bottoms are flat on a hardwood surface and their spines are straight. Cindy, one more question. Talk to us about sitting and about the pelvic floor.
Just all that intra-abdominal pressure, I think, without any conscious pulling up or being aware of it, it's always got pressure on it when you're sitting.
And that's another thing that we talk
So
about.
extra weight in your belly and weak stomach muscles, which oftentimes happens to those of us who have given birth and had stretched out bellies, that can make the pressure down on your pelvis a lot more.
Yeah, and so that's why we have to really, learning this breathing system and practicing it every day. When you think about the times I do it in the car, just driving back and forth to work, breathing and feeling the lift of my pelvic floor. Because sooner or later, once you find the lift, you're going to be able to feel the lowering of the pelvic floor. So this is something I do every single day, at least 3 times a day on my movement and my exercise fitness. I do it up to 5 times a day. But let us show you one more thing. So let's go ahead and have you stand, Cindy. And we're going to show you a little wall work, because wall work is a valuable tool because, again, it sets our spine in the perfect position, a neutral spine position. So what I've asked Cindy to do is actually do a slider, it's called, because when you work your glutes, when you work your hamstrings, that posterior part of your body, it's quite helpful to you to understand that you're working the pelvic floor too. So in this movement, the feet, and she's got a very wide stance, which is acceptable, parallel is acceptable. We're just going to ask her, and in Cindy's case, because she carries stress in her shoulders, she does, we're going to ask her to just gently try to pull those shoulders back so that the chest can recognize the opening here. Now what she's going to do is, as she lowers down, I'm going to ask her to bend her knees, and I want to show you that when you bend your knee and you actually bend that knee like this, make sure that you're aiming right here for that crease right in between your big toe and your second toe, like that. So the breathing is really important here. So we're going to, ready? We're going to inhale, knees bend forward, and exhale, up. Now this is a movement I've taught to my mom in her 80s. Inhale, and exhale. The whole tummy is going to go up. That's when the pelvic floor actually contracts. Let's do it 2 more times. Inhale, and exhale, and 1 more time, Cindy. Inhale down, and exhale back up. That's when the pelvic floor rises. Now, for a lot of you that struggle with knee issues, this is really great because you can modify it by just going down a little and then coming back up. So remember, inhale, go down, exhale, come up, because that's what we want to train in the pelvic floor. One that is long and strong and one that is short and strong, contracted. And the final one is off the end of my Avalon system. I'm just going to pull it this way. And it is just squatting, and we squat. Every time I go to the bathroom, I will at least do that. You know, just to keep those muscles stretched, to keep the pelvic floor elongated. Because your pelvic floor is kind of shaped like a little trampoline. When the abdominal contents go down, it opens up and elongates. When you contract and pull up with your tummy, it contracts too. So she's just going to find a comfortable position. As soon as you figure out that you can actually squat for long periods of time, add the hang to it, because then you get this beautiful, beautiful stretch through here, and you're automatically elongating your pelvic floor. That's what you want. Lateral thoracic breathing, wall work, and squatting. But I say squat hang or hang squat. So thanks for joining us. Again, if you have any questions, you're more than happy to email me or text me. And thank you, Dr. Cindy Works. We'll see you soon.
It was fun, Sharon. Thanks.